Welcome to Food Safety 5, twice monthly reports from the Food Safety Magazine editorial desk to keep you abreast of top news stories and current events impacting the food safety sector. This episode, we're discussing new data from the U.S. Centers for Disease Control and Prevention about the pathogens causing foodborne illness and contributing factors of outbreaks, as well as research by CDC, USDA, and FDA scientists exploring the use of AI analysis of whole genome sequencing data for foodborne illness source attribution. First, CDC recently updated its estimates for the burden of foodborne illness in the U.S. based on an analysis of the national surveillance data from as recently as 2019. CDC looked at the number of illnesses, hospitalizations, and deaths caused by 7 major foodborne pathogens: Campylobacter, Clostridium perfringens, Listeria monocytogenes, neurovirus, non-typhoidal salmonella, Shiga toxin-producing Escherichia coli or STEC, and Toxoplasma gondii. Together, 6 of the 7 foodborne pathogens included in the dataset, excluding Toxoplasma gondii, caused an estimated 9.9 million domestically acquired foodborne illnesses in the U.S. in 2019. All 7 pathogens, including Toxoplasma gondii, together caused approximately 53,300 hospitalizations and 931 deaths in 2019. Neurovirus was the top contributor to foodborne illness, responsible for 5.5 million cases, and was also the leading cause of hospitalizations, sending 22,400 people to the hospital. Salmonella, however, was the deadliest foodborne pathogen, causing 238 fatalities. CDC also recently published a report on the contributing factors of foodborne illness outbreaks based on national surveillance data from 2014 to 2022. Different than the estimates for sporadic cases of foodborne illness, CDC calculates that approximately 800 foodborne illness outbreaks occur in the U.S. each year, causing 15,000 illnesses, 800 hospitalizations, and 20 deaths. CDC found that many foodborne illness outbreaks occur because of contamination of food by an animal or environmental source before arriving at the point of final preparation. Additionally, most viral outbreaks, like neurovirus, are caused by contamination from ill food workers. The data also showed that common contributing factors to bacterial outbreaks are 1. Allowing foods to remain out of temperature control for a prolonged period, and 2. Inadequate time and temperature control during cooking. In other foodborne illness source attribution news, researchers at CDC, in collaboration with FDA and USDA researchers, recently trained a machine learning model to use whole genome sequencing data to estimate the food sources of salmonellosis cases. Using a random forest algorithm, the researchers trained the model with national surveillance data for salmonella illnesses with known causes of infection, as well as data for salmonella isolates from food animals at slaughter. The model was tested against a database of salmonella clinical isolates with unknown sources of illness reported to CDC. The model demonstrated a promising 91% accuracy level when only confident model predictions were retained. Also, when looking at only confident model predictions, the model attributed chicken and vegetables together to 73% of salmonellosis cases. The model also estimated that chicken was the most common source of infections by Salmonella serotypes enteritis, Typhimurium, Heidelberg, and Infantis. Overall, the researchers believe that algorithmic analysis of whole genome sequencing data shows promising utility for foodborne illness source attribution, and with further research, could aid outbreak investigations. For more information on any of the stories mentioned in this video, be sure to check out the Food Safety Magazine coverage linked in the description of the video. Check back twice monthly on Tuesdays for the latest Food Safety 5 episodes, available at food-safety.com or on our YouTube channel.